911 Global Meds Disclaimer. This video and any contents herein are posted on this YouTube channel of 911 Globe Meds for informational and educational purposes only. Please see the detailed video contents disclaimer and the copyright disclaimer in the text section below.
I'm here discussing the clinical outcomes following Pamidronate use in patients with chronic critical illness. So this was a study that actually took place at the Mount Sinai Hospital in a cohort of patients with chronic critical illness. Now, this is a population which has prolonged critical illness, requires mechanical ventilation and a tracheostomy, and typically a very sick population. And we wanted to investigate the use of Pamidronate, which is a bisphosphonate, to improve clinical outcomes. Now, Pamidronate has been used previously in chronic critical illness in this unit, and we've studied it in the past and have shown that elevated bone resorption, which is common in chronic critical illness, biochemically improves following Pamidronate. That's already been shown, but what we wanted to do in this study was assess mortality, ventilator liberation, as well as renal function, and basically to see if giving the Pamidronate to decrease the bone resorption can improve these clinical outcomes. Patients designated with chronic critical illness are those that receive a tracheostomy after a prolonged course in the ICU, which is typically after at least 10 to 14 days of mechanical ventilation, because at that point it's determined by the ICU team that they're not going to either expire or be cured in the short term. Giving the IV Pamidronate did lower RCU and 1-year mortality in patients within our CCI, chronic critical illness cohort. Patients receiving Pamidronate had improved mortality. Additionally, they had higher likelihood of liberation from the ventilator. So we thought this was highly significant. We also tested assessed their renal function, as this is considered, renal function is considered a barrier to use of bisphosphonates, and we wanted to show that it would be safe. So we looked at parameters of renal function, creatinine and GFR, and not only were they stable, but there were some slight improvements in creatinine following Pamidronate. So it appears very stable from the renal perspective, and our study looked at patients with both normal and abnormal renal function, all levels of chronic kidney disease. We did not encounter any safety issues. The main concern in general for bisphosphonates is the renal function, and we did look at that very closely and did not find any detriment on the renal function. So this is a whole new way of approaching. Basically, patients with chronic critical illness, the focus tends to be trying to get them off the ventilator, but there's a lot more going on in their body that may not be focused on. Generally speaking, in most hospitals, no one's looking at what's happening to their bones during this period that could be for months that they're in the hospital. So at Mount Sinai, there's a series of protocols in the respiratory care unit specifically looking at the effects on the bones, and we're really the first group to be describing these kind of effects, and this is the first study looking at effects of Pamidronate on improved clinical outcomes. With that said, this is a retrospective study, so before we would have this implemented in the grand scheme, we would need prospective studies to confirm our findings. We still need to find the best way to expand this into smaller facilities. Right now I'm working at North Shore LIJ, and I hopefully will be able to expand it here. But like I said, so far we've had retrospective studies done. The next step would be doing prospective studies to confirm that these are complete findings that we would want to recommend to all hospitals.